So what neighborhoods across Clark County are getting the vaccine or are not? We finally have a closer look by your zip code.
I know these zip codes well. I am alarmed at what I am seeing.
The darkest shades on the map, the northwest parts of the valley, are zip codes with the highest COVID-19 cases and communities of color. How do those same communities fare with vaccines? Watch those same zip codes slowly turn pale. The highest vaccination rates, the darkest parts, are in the suburbs. The health district does say 40% of doses have been given to first responders so far, who may not live in these economically challenged areas.
We are working boots on the ground to get into those neighborhoods, educate many of them the importance of getting the first dose and the second dose, but to having those pop-up venues.
If you go to the Martin Luther King Center, you can see the results of the efforts that are taking place to reach these parts of the community.
As pop-up sites continue across the valley to help communities of color, the health district promises target teams for residents in these hard-hit neighborhoods.
So 89110 is a zip code that we've been focusing on quite a lot. It's had the highest COVID-19 case count. What is lacking here are clinics, community resources.
Nonprofit Puentes helps connect underserved communities and Latino communities with social services and health care. And pop-up sites give supplies and flu shots. They are ready to help roll out a pop-up site for vaccines to curb the spread of the virus in 89110.
Various barriers to accessing care. That can be transportation, there could be language literacy challenges. So what has to happen in these communities is you have to have direct outreach. We used to say face-to-face, mask-to-mask outreach.
If you want a closer look at those maps and your neighborhood, head to our website, fox5vegas.com. Chair Kirkpatrick says over the next couple of weeks, there's going to be a lot more outreach in different languages, from food banks to other community centers.